Thank you. It's thrilling to be here today as a resident of Orlando and a resident of Florida to see this great structure, and also to be here with Chairman Jeff Miller and Ranking Member Kareem Brown, my two partners on the House Veterans Affairs Committee, to help serve the veterans that are here. It's also wonderful to see the number of members of Congress and Mayor Dyer and others who are here to help us with this celebration. And I want to thank Carolyn for that kind introduction. It's Carolyn's outstanding leadership which has been critical to right the ship for the Veterans Health Administration, and Carolyn, we're forever grateful for that leadership. I'm batting last in a long lineup, so I want to be brief. VA has set its sights on three main priorities: increasing access to medical care, both in VA and in the community, eliminating the claims backlog, and ending veterans homelessness. We've made progress on each priority, but we still have work to do. In the past 5 years, we've reduced veterans homelessness by 33%. In the past 2 years, we've shrunk the claims backlog by 74% and are now below 150,000 claims. And in the past year, one is too many. And in the past year, we've completed 2.4 million more appointments than in the previous 12 months, and we've shrunk the electronic wait list by 55%. 97% of appointments in March were completed within 30 days of the veteran's preferred date. 20% were same-day appointments. 22% were completed in non-VA community providers. We're now completing 500,000 mental health appointments each month, with an average wait time of about 3 days. And we're bringing in new leaders to help us continue to make progress on these issues and help us on other issues that are important to veterans. Orlando veterans have seen an even steeper decline in the electronic wait list. A year ago, it peaked locally at over 2,400. It's now down to around 900, a 62% drop, but again, even one is too many. So I want to thank Tim Lazert and the whole VA team in Central Florida for their hard work on the access issue. Getting where we are today on access has meant a lot of extra appointment hours, including weekends and late evenings. It's also meant increasing authorizations for non-VA community care by 45% and by hiring more healthcare providers. 11,000 more Veterans Health Administration employees, including 970 physicians and 2,100 new nurses. More people need more space to work. So we've expanded VA's healthcare footprint by 1.4 million square feet. And we've helped more veterans get their care in the community than ever before. Now, a major challenge in expanding veterans' access to health care is aging infrastructure. 900 VA facilities are over 90 years old, and 1,300 VA structures are over 70 years old. These older structures don't meet today's standards for hospital construction. They were designed to provide health care in the 1930s, not the 2020s. Their rooms are too small to accommodate state-of-the-art medical equipment and procedures. They lack privacy, convenience, and comfort for veterans, especially female veterans. And they need to be replaced with new facilities. Florida veterans have been very fortunate. They have had the men and women seating here today to speak for them here and in Washington. And just by looking around, we can see how faithful and effective these advocates have been in responding and representing Florida veterans. But veterans' needs are not limited to Florida. The challenges of the VA in 2014 were created because we didn't have the medical providers nor the infrastructure for the increased demand created by the aging of the veteran population. While the total number of veterans is actually declining, the total number of issues of veterans and of veterans needing help in the VA system is increasing. It's not because of Afghanistan or Iraq. It's because of the aging of the veterans that served during the Vietnam era. In 1975, there were 2 million veterans over the age of 65. In 2017, there'll be nearly 10 million veterans over the age of 65. Most of these aging veterans were served during the Vietnam era, and not surprisingly, as we age, more medical issues become chronic. We need to build the infrastructure of VA care and community care today that we need when the veterans of Iraq and Afghanistan age. If we don't close the gap now, we could be facing another crisis in VA care 20 to 30 years from now. I would therefore ask that those of you who've advocated so effectively for Florida's veterans do the same thing for veterans everywhere in the United States. It's time now to build the buildings today that veterans will need in the future, and we will need more in the coming decades. And I promise you that VA will do a better job in getting more veterans care in the community, and also in the efficient and effective construction of those new leases or those new buildings. VA can do nothing on its own. We depend on Congress for funding and for authorization. We depend on veteran service organizations for advice and assistance. We depend on thousands of public and private partners to contribute their own resources and expertise to countless causes on behalf of America's veterans. And we depend on our own employees to go the extra mile in serving veterans. This summer, we at the VA are renewing our commitment to America's veterans, and we're asking others to join us in that commitment. We're calling it the Summer of Service. In the next 3 months, we'll be turning the spotlight on VA volunteers to thank them for the work they do and to show others how they can help as well. Last year, over 1,000 people volunteered here in Orlando, working over 100,000 hours, as much as 72 full-time employees. Nationally, 76,000 VA volunteers helped out last year at hospitals and clinics, at cemeteries, in veterans-owned homes. Our goal for this summer of service is 100,000 volunteers by the end of August. We also do want to do more this summer with and for our strategic partners. Making the most of our strategic partnerships is one of our objectives of our My VA initiative. Toward that end, I just signed a new VA policy directive to make it easier for other organizations to partner with VA by standardizing our partnership process and making it more partner-friendly. In my 10 months as Secretary, I've seen many outstanding examples of personal and corporate generosity. This summer of service will spotlight those efforts as well. We're deeply grateful for the efforts of all of our volunteers and partners, and we look forward to doing more together in the future. Thanks again to everyone who supported the building of this facility, and to the VA employees and volunteers who will work here. This facility is a monument to service, service to the nation, and service to veterans. May God bless America, and may God bless our veterans. Thank you very much.
Thank you, Secretary